What is a post-void residual, PVR bladder test? Have you ever wondered how doctors assess bladder health? One important tool they use is the post-void residual, or PVR, bladder test. This test measures the amount of urine left in the bladder right after you urinate. It helps determine how well your bladder empties, which is crucial for diagnosing issues like urinary retention and other bladder function problems. The PVR test is especially useful when patients experience symptoms such as frequent urination, urgency, incontinence, or recurrent urinary tract infections. It can also provide insights for individuals with bladder cancer, as tumors or treatments may impact bladder function. There are two main ways to perform a PVR test. The first method is an ultrasound bladder scan. This is a non-invasive procedure where a handheld ultrasound device is placed on the lower abdomen. It visualizes the bladder and estimates how much urine remains after you have voided. This method is quick, painless, and does not requiring any tubes or catheters. The second method involves catheterization. In this process, a thin, flexible tube called a catheter is inserted through the urethra into the bladder after urination. This allows healthcare providers to drain and measure the residual urine directly. While this method is more invasive and may cause some discomfort, it provides a very accurate measurement of the urine left in the bladder. Typically, normal PVR volumes range from 50 to 100 milliliters. If the volume is higher, it may indicate that the bladder is not emptying completely. This could be due to several reasons, such as bladder outlet obstruction, weak bladder muscles, or nerve-related issues. For patients with bladder cancer, PVR testing can help monitor how well the bladder is functioning, especially if treatments like surgery or radiation have been performed. The good news is that the PVR test usually requires no special preparation. After the test, patients can go back to their normal activities right away. If catheterization is used, there might be some mild discomfort or irritation, but this typically resolves quickly. In summary, the post-void residual bladder test is a valuable diagnostic tool. It helps assess how well the bladder empties, guides treatment decisions for urinary problems, and monitors bladder health in conditions like bladder cancer. If you have concerns about bladder function, it is always best to consult with a healthcare professional who can provide personalized advice and care.